Hi, my name is Irina, and for my drug infomercial, I decided to do it on sedative and hypnotic agents, also known as central nervous system depressants. So, what are sedatives and hypnotics? So, depressants are typically classified according to their effects on our central nervous system. Thus, they're either Schedule 4 or 5 drugs. Sedatives cause mild depression of our CNS and relaxation, and these can be considered as anxiolytics or anti-anxiety drugs. Hypnotics induce drowsiness and sleep and can cause amnesiac effects. Depending on the dosage, a drug can act as either one. So a low dose would be like a sedative, high dose would be like a hypnotic, and an even higher dose would be considered as an anesthetic. These are typically taken orally, can legally be obtained through prescription, and can typically cost under $20 with insurance. They affect neurons that have receptors for the neurotransmitter GABA by increasing inhibitory effects. Some popular agents. So the most popular one would be benzodiazepines, or benzos for short, and examples would be like Xanax, Valium, Klonopin. These replace barbiturates due to its abuse liability, thus they're safer. Benzos are still very popular today, even after the medical community became aware of the problems associated with depressants. Some other drugs would be like Mickey Finn, Quaaludes, Miltown, date rape drugs, and antihistamines due to its anticholinergic effects. Alcohol has similar effects as the drugs mentioned, however, it is classified as its own category. Some common medical uses for sedatives would be to relieve anxiety, neurosis, fear, apprehension, and relaxes muscles caused by muscle spasms, and can also treat seizures. Some uses for hypnotics would be to help with insomnia by inducing drowsiness and encouraging sleep. It can help relieve from withdrawal symptoms. With that being said, depressants should be avoided if you're pregnant or may become pregnant as it affects the growth of a fetus. Side effects on body and brain can range from drowsiness to paradoxical effects such as anxiety, irritability, sweating, restlessness, bizarre behavior, slurred speech, memory problems, low blood pressure, and rashes, just to name a few. And it can cause disrupted personality changes. This can all be caused due to wrong dosage. It can also affect the ability to drive or perform certain tasks due to depressed CNS, and it could possibly lead to tolerance, dependence, withdrawal, and abuse if misused. Long-term drug use can impair cognitive functions, such as impaired visuospatial and visiomotor abilities. It decreases IQ, motor coordination, psychomotor speed, speed of information processing, verbal learning, concentration, and delayed response time. So some withdrawal symptoms would be rebound of anxiety or insomnia, tremors, nausea, delirium, maniacal activity, and seizures, which can be life-threatening if there is no medical intervention. Symptoms occur sooner with shorter acting drugs and typically last up to 2 weeks, but longer acting drugs peak at around 2 weeks and can last up to a month. Sedative, hypnotic, or anxiolytic drug use disorder falls under the substance use disorder category. Dependence of depressants is recognized as a psychiatric disorder, and this is diagnosed within a 12-month period. Some symptoms of dependence include constant craving of a drug even after trying to cut down, physical withdrawal symptoms when one stops taking the drug because your body's internal environment changes so suddenly, desire to take drug despite drug-related issues, important social, occupational, or recreational activities are given up or reduced because of drug use, and continues use even after recognizing its risk and consequences. Abuse patterns. So, abuse and dependence is not the same. Abuse implies that the user is taking drug outside of its intended purposes. With that being said, chronic users are at high risk of abuse, and it can easily be abused if misused. It's actually the second most frequently abused prescription drug and sometimes contributes to death due to accidental overdoses. Those who use drugs as stress relief to paradoxically feel euphoria, stimulation, use depressants to counteract side effects from other drugs of abuse, such as LSD, or combine depressants with other drugs are more likely to abuse sedatives and hypnotics. That was it for my presentation. Thank you for listening, and these are my references. Bye.